Okay, what is an allergy? Allergy is a hypersensitivity disorder of the immune system. Allergic reactions occur to normally harmless environmental substances known as allergens. These reactions are acquired. They're also predictable and rapid. Strictly, allergy is one of the 4 forms of hypersensitivity, and it's called type 1 or immediate hypersensitivity, basically dealing with your senses and anything that can affect your senses, which is mainly the environment, the pollen, and dust, as we'll go on in the slide. Next slide, please. So the signs and symptoms of allergies. Many allergens, such as dust or pollen, are airborne particles. In these cases, symptoms arise in the areas in contact with air, such as eyes, nose, and lungs. Allergens can also result from foods, like some people are allergic to peanuts. For instance, I'm allergic to cats, but I'm not allergic to dogs. Sometimes deal with the hair. Insect stings and reactions to medications like aspirins, even antibiotics, sometimes like penicillin, people are allergic to that. Symptoms of food allergy include abdominal pain, sometimes bloating. So sometimes allergies are not only a form of, sneezing and watering your eyes, but it also can be something inside your stomach. Vomiting, diarrhea, those also can be signs. Itchy skin, swelling of the skin during hives. Food allergies really cause respiratory or asthmatic reactions, but in my case, when I obtain allergies, my asthma does occur. So it's mainly respiratory for me. And insect stings, antibiotics, and certain medicine produce a systematic allergic response that is also called anaphylaxis. So that's basically something can be in the air, or the cat hair, and it can go on your face, or you can sometimes smell it, and that causes an allergic reaction. Organ systems can be affected, including the digestive system. Again, a lot of people think when it comes to allergies, it's just the nose, it's just the eyes, you're sneezing or coughing or whatnot, but it can also be stomach. You can have diarrhea, you can have problems inside your stomach. It can also affect your organs. Depending on the rate of severity, it can cause continuous reactions, bronchoconstriction, edema. It can be so severe it can cause death and a coma. So that's why I'm under 2 medications, which is Singulair and Allegra. Next slide, please. So common allergens, again, like I said, it can be pollen, it can be dust, but here are the main ones. Pollen from trees, grass, and weeds. Allergies that occur in the spring, which is usually late April and May, which we're in now, are often due to tree pollen. Allergies that occur in the summer, late May, and to mid-July, which is coming now, are often due to grass and weed pollen. Allergies that occur in the fall, late August, the first frost, are often due to ragweed, depending on the temperature and things. Give me a second, guys. Sorry. Okay, mold. Mold is common where water tends to collect, as you guys know, such as shower curtains, which is the most common where you can find mold easily. Window moldings and damp basements. That can only cause allergies, but other symptoms as well. It can also be found in rotting logs, hay, mulches, commercial peat moss, leaf litter. This allergy is usually worse during humid and rainy weather where it can collect the most mold it can. Animal dander, as I said, for some reason I'm not allergic to dogs' fur, but I'm allergic to cats. It has to do something with, their fur, their DNA, or where they're at. That affects me. So proteins found in the skin of the animal, saliva, or the urine, or furry pets such as cats and dogs can cause allergens. You can be exposed to dander when handling an animal, or from house dust that considers dander. So you don't necessarily have to be playing with the animal, but just because its fur is lying around and it's in the air, it can cause allergies. Dust, as I mentioned before, many allergens, including dust mites, are in dust. Dust mites are the living creatures found in bedding, mattresses, carpeting, upholstery, furniture. They live on dead skin, and we take showers, so we have dead skin everywhere. And other things found in the house. So, as you can see from these, it's better. Actually, it's helpful if you clean, like if you have like a house that's maintained and cleaned. If you suffer from allergies, if not, just hygiene. Next slide. So there are two responses that I found when it comes to allergies, like the transaction that happens when you have allergies. So there's an acute response. In the early stages of allergy, a type 1 hypersensitivity, again, because this is a general allergy, it's not a specific allergy. Hypersensitivity reaction against an allergen encountered for the first time causes a response in a type of immune cell called a Th2 lymphocyte, which belongs to a subset of T cells that produce a cytokine called interleukin 4. These Th2 cells interact with other lymphocytes called B cells, whose role is production of antibodies. With anything, antibodies will come to protect you, whether it deals with cuts, whether it deals with a cold or anything. You're always going to have antibodies there to help you. Coupled with signals provided by that IL-4, these interactions stimulates the B cell to begin production of a large amount of a particular type of antibody known as the IgE. Secreted IgE circulates in the blood and binds to an IgE-specific receptor. So this, there's many types of receptors, but it's mainly the IgE receptor. On the surface of other kinds of immune cells called mast cells and basophils, which are both involved in the acute inflammatory response. So that's usually the inflammation that you may feel in the nose. This is like the response that you may get occurring in your nose. Next slide. Thank you. So this is the second response, which is the late phase response. So these Th2 cells interact with other lymphocytes called B cells, whose role is production of antibodies, coupled with signals provided by the IL-4. This interaction stimulates the B cells to begin production of a large amount of a particular type of antibody known as the IgE. So the specific type of antibody would be the IgE to help reduce the inflammation that would be in your nose or any other things that may occur inside your body. Secreted IgE circulates in the blood and binds to an IgE-specific receptor. And on the surface of the kinds of immune cells called mast cells and basophils, which are both involved in the acute inflammatory response. So not only is it in the late phase response, but it's also in the acute, the first stage of response. Next slide. So diagnosis. I'm just going to tell you now, diagnosis sucks if you want to find out if you have allergies, because the only very accurate way that you can find out if you have allergies is through testing of the skin and blood work. So skin testing is also known as puncture testing and prick testing due to the series of tiny puncture or pricks made into the patient's skin. Small amounts of suspected allergens and or the extracts of pollen, grass, mite proteins, and peanut extract are introduced to sites on the skin marked with pen or dye. The ink dye should be carefully selected lest it cause an allergic response itself. So in this case, you are the test subject, and they're just basically waiting to see if any allergic reaction occurs in any part of your body. So it's just basically the immediate response. A small